Well, what we'll do is just get started, like just like we're chatting on just actually, I think people will be interested in the diagnosis. So maybe just like what your diagnosis is and what kind of symptoms that means, or what do you deal with?
Oh, so I have like born with cerebral palsy, spastic triplegia. I've also been recently diagnosed with follicular lymphoma.
Mhm.
So that's a
Right.
chronic disease. It's basically managed. So with the CP and everything, there are times where there's a lot of pain just because you're sitting in positions all the time. I'm sitting in a wheelchair all the time, so I'm
Mhm.
always sitting down, so it can get uncomfortable with pain.
Mhm. Mhm.
So it really cannabis really helps me in
Yeah.
that way.
And like as far as pain goes, and before we get to cannabis, what over the years, what do you remember some of the medications that you've used in the past to manage pain?
Oh, sure. I have everything from some perks to like
Yeah.
anything like that, right? Like, and also too, because I'm a former Paralympian, I had a lot of injuries,
Mhm.
shoulder injuries, knee injuries, elbow injuries. So
Yeah.
all
Yeah.
from repetitive motion, right? So
Right.
it got worse and worse over the years.
Right. So you have the pain from your underlying condition and of course being in your wheelchair, but
Yeah.
also because you're an athlete too, a lot of kind of chronic wear and tear injuries.
Yeah, for sure.
Okay. So, you mentioned perks or Percocets, and, obviously really happy that you're no longer using those.
Yeah.
And what have you found in using CBD, THC? Like, has that been helpful in managing the pain?
Yeah, absolutely. And especially on the CBD, the high CBD side, I also for the daytime, it's amazing. The
Yeah.
effects of the uplifting it gives you.
Yeah.
It makes you feel better about yourself. You're
Mhm.
not as depressed. You don't have a lot of anxiety. You
Yeah.
feel motivated to do things
Yeah.
during the day.
Well, that's so nice to hear. And it highlights, yeah, we were talking about pain, but it also, like you said, has been helpful for your mood and your anxiety.
Yeah, exactly. And that's a big thing, especially right now with the last 2.5 coming 3 years with the pandemic too, right?
Mhm.
It hasn't been easy for a lot of people.
No, no, that's the truth, and certainly I know you see it, I see it.
Yeah,
Um, so it is nice that you're getting some relief from pain and the mood side of things.
absolutely. I love it.
When it comes to actually affording this medication, what's the status there as far as kind of the issues with cost and things like that?
Yeah, for me, so I am an Ontario disability recipient. So I get the maximum of $1,169 a month. So I have to pay rent and
Mhm.
bills and everything else with that. So the cost of it is really not affordable.
Mhm.
When I do have a little bit of extra, I will go ahead and order. I wish I could use it more on a regular basis but because of affordability, right now I can't. So
Yeah.
hopefully,
Hopefully,
fingers
right?
crossed,
Yes.
whoever decides to give authorization to put a DIN number on it, we can get some coverage here for the people for everybody, right? Because it is quite expensive.
Yeah, yeah, and that's the important thing for people to know is that it helps, but when you're on disability and you have to obviously budget for your groceries, your utilities,
Yeah.
it's really unfair that you have to carve out some money for the medication that helps your pain and your mood.
Exactly, because I find it weird that the government will cover any opioid,
Mhm.
literally no problem. You can go to a doctor and get an opioid, and here you go. But
Yep.
we all know the addictive properties of opioids and the opioid crisis in the
Mhm.
country, but yet they won't give access to anything that doesn't have addictive properties.
Yeah, yeah. No, it's crazy in that
Yeah,
perspective. We know how harmful the opiates are and they're covered.
yeah,
And here we have something that's natural, that's beneficial, that you got to
and
pay.
minimal side effects too.
Oh yeah, very well tolerated, minimal side
Yeah,
effects. especially on the CBD side, a lot of people don't understand that that's
There's,
non-impairing. You can take it during the day.
yeah, there's really nothing to
Yeah,
the CBD side.
yeah, and you're not trying to get high.
Yeah.
Now, it's very logical, of course, as we're talking about it. It would make sense to cover it, but that's why we're doing this, raising the awareness, because the people who make these decisions still don't get it as far as I'm concerned when it comes to coverage. So if you could kind of speak to some of those people who make those decisions, what would kind of the final statement be? What would you want to tell them?
Well, I really think it comes down to you got to put yourself in our shoes. Like there's the people that can't afford these things or can't afford the supplemental coverage to get the coverage. Like put us in your shoes. Like, come on. Like I've been on disability since I'm 18. The rates haven't changed
Yeah,
since I'm 18.
yeah,
So
yeah,
think of the cost of inflation now. Like everything is more expensive, but no one wants to put us in their shoes. They
yeah.
say go get a job,
Mm-hmm.
but
Mm-hmm.
we can't all go get a job, or we
No.
can't all work at a full-time basis to be able to cover things.
Mm.
We're like, it's kind of like we're left behind.
Yeah. No, and it's a story that needs to be told. You nailed it too with inflation. You see these things that used to be, you know,
Like,
coffee, bananas, fruits, vegetables, like these things are all going up, but your income is staying the same.
yeah,
And that needs to be addressed as well. We need to cover cannabis, of course, cover your CBD, but also adjust for inflation as well.
yeah, exactly. Just give us a little bit more support here. Come on, like
Yeah.
we're not being talked about.
Yeah.
The Canada Persons with Disability Benefit was supposed to be in the budget for 2022. I read it, it wasn't in there. So what's going on? It was
Mhm.
supposed to be in there. Come on, people.
That was just kind of conveniently left out.
Exactly. Like, don't promise something and not deliver.
Yeah. Yeah. Well, there. That's probably a good way to end.
Yeah,
Right on. Well, thanks so much, my man. That was fantastic.
no problem. Anytime.
Yeah. And hopefully by doing this, right, we'll get this in front of the people that need to see it, so that these stories, I think, honestly, Rob, are the thing that's gonna move the needle for us.
Well, thanks very much, Doc. I appreciate all your help.